surgery. This is our first Tuesday tips of the year. Thank you so much for all the followers. Thank you so much for all the questions you've been sending me. I hope we have time to answer all of them. And if you didn't put the questions in the DMs or in the boxes, don't worry. You can put them in the comments here and we'll get to it at the end of the live. What are we talking about today? We're going to be talking about implant rupture. This is a very common topic of discussion and what to do once you know if you have an implant rupture. So we'll go over all of those details, okay? So let's start by defining what an implant rupture is, and it depends on the implant type. So we know we have two different implant types, saline and silicone. Both the shell or the covering of the implant, right? So the outside of the implant is silicone based on both, okay? What changes is what's in the inside of the implant, okay? So saline, you filled it with saline, water, and silicone is the one that it's gel filled, or the one that we call gummy bear. Why is it called gummy bear? It's because of the cohesiveness of the gel. So implants that were made before this generation of implants. So this is the 5th generation of silicone implants. So older implants, the gel was not as cohesive. What does that mean? Not the stickiness of the gel particles. So it was more fluid, tend to leak, or when it ruptured, deflate. The gel ones now, the gummy bear type, the cohesiveness of the gel is more, which means that it's not liquid on the inside, okay? So even if you break or rupture it, the gel itself stays in its form, okay? So like a gummy bear, and it doesn't leak in the body and will not deflate, okay? So that's one of the most important things to know about the implant rupture when we're talking about silicone. And because the diagnosis changes when it's silicone, I'll focus more this talk on gel implants. Why? Because if a saline ruptures, you'll know right away. Why? Because it's water, it'll deflate. So you'll know right away. Soon, one breast will be asymmetric, so you'll know right away to call your plastic surgeon and get it fixed. With gels, you won't know, and that's why it's called silent rupture, okay? So what's the percentage? How many implants rupture? So that depends on the brand, and I'm going to stick with Allergan because that's the implants that I use. There are different types of brands out there. Mentor, Sientra implants. Allergan is the one that I use here at Pure. So these are the rates documented in the brochures on the Allergan research that it's online. You can go to allergan.com and check on that. And in 10 years, that's why 10 years. And this is a very common misconception that people think that because it says 10 years here, that in 10 years I need to change them. That is not true. The reason why we hear a lot about 10 years is because the studies, when we're following up patients, they were done for follow-ups up to 10 years. So the data that we have to say how many implants rupture, how many capsular contracture develops, how many infections, how many hematomas, we can say it on the research up to 10 years because that's how far the data was collected for on those patients, okay? So that's why this year is there. It's 10 years because that's how long the patients were followed in those studies, and that's the data that we have. So in a 10-year period, all the patients that have implants, gel implants put in, the rate of rupture is 9 to 13%. So it's not very high when you consider all the patients that were put on a 10-year period, only 9 to 13% rupture, okay? So it's a low rupture rate. The rate of rupture tends to increase with time. So the older the implant, the higher the likelihood of rupture. Why is that? Wear and tear, okay? Just like tires, right? The longer the implant is there, the longer this capsule is gonna be in your body. So it tends to thin down, making it easier to rupture, okay? So with time, the implant is more likely to rupture. It doesn't mean, again, that it will rupture, and it doesn't mean that you'll need to change it, but it just means that you need to follow up and check, okay? Why? Let's do a little test. So this is an implant, right? I'm gonna try to rupture. It's very hard. This is a very tight capsule, okay? I'm gonna try to squeeze it. I'm gonna try to pull it. It won't rupture. The capsules are really, really tough. So even if you're in a car accident, mammogram, it's very hard to rupture this, okay? But I will, just to make a point. So how I'm gonna rupture it? By poking it, okay? This is a needle, okay? So I'm gonna poke it. And you see how the gel stays in its shape, is not leaking. And when I put it like this, it goes back to its original shape, okay? And that is what gummy bear implant means, okay? The gel is cohesive, so it sticks together, doesn't leak, it stays in its shape, okay? So if this happens in your body, the implant would stay as it is, okay, inside the capsule, so you won't know. And that's why it's called a silent rupture, okay? Some patients report some pain, some inflammation in the area of the implant.
Discomfort.
Yeah. But not everyone. The majority of patients are actually asymptomatic, so they don't notice any difference when they have an implant rupture, okay? So what is the recommendation? How do I know? So the FDA recommends if you have silicone or gel implants in place, you should get an MRI or an ultrasound 5 to 6 years after you get the implants placed, and then every 2 to 3 years thereafter to monitor for silent rupture, okay? If you're getting your mammogram and ultrasound for breast cancer screening, then you're getting an ultrasound every year, okay? And you'll see the implant, and if there's any concern with the ultrasound, the radiologist will say there's a concern, it may be ruptured, and then you go ahead and do the MRI. The MRI is more sensitive, okay? So whenever we have the suspicion or the clinical question that if there is a rupture, this is the study I'm gonna order. We're gonna order an MRI to check the capsule, okay? To check if the implant is ruptured or not. If it is ruptured, yes, we need to either change it or remove it, okay? Is it an emergency? No, it is not an emergency, okay? Why? Because like I showed you, the implant is not gonna deflate, it's not gonna leak, it'll stay there, but with longer the time, the implant rupture there's more inflammation, and the risk of developing problems with the capsule, like capsular contracture, is higher. How long, and this is a very common question for my patients, how long can I wait? Unfortunately, there's not data to let us know you can wait this or X or Y amount of time. I always tell my patients, if we find a rupture, let's do it as soon as possible, okay? Does that mean we need to do it tomorrow? No, we don't need to do it tomorrow, but we shouldn't do it in 5 years, okay? We should do it in a timely manner, okay? So if we detect a silent rupture, or if the implant deflates, or if we have a rupture, then we need to do surgery, okay? What surgery? That depends, okay? We can remove the implant or replace it. How do we decide? It's up to you, okay? So at that point in life, it's up to you. Do you want to were you happy with that volume? Were you happy with your implants? You didn't have any pain, any problems with them? Then replace them. We can replace them with the same volume. We can actually use the same implant volume if you were happy with them. But since we're doing surgery, most of the time then we get to do changes of things that were bothering you a little bit maybe, and now because we're going in and replacing the implant, we can go ahead and do making the implant smaller, putting a bigger implant, any of that, we can go ahead and do it, okay? If you want them removed, of course we can remove the implant. We'll remove it with or without the capsule, and I'll talk a little bit about that. And then what do we do with the breast? Because the breast has already been stretched, and that is one of the important things when we're doing breast implant surgery, right? Especially breast augmentation. In a patient that doesn't have a lot of breast tissue, you put an implant, you're stretching the breast tissue and the breast skin. So if you decide to remove the implant, then that skin and breast tissue is going to be stretched and it's going to sag, okay? So most of the time if you decide to take the implant out, and that is a very personal decision, if you decide to take the implant out, then most of the time we're going to have to do a breast lift to reshape the breast and tighten the breast pocket or the breast skin to avoid from being saggy, okay? So implant removal or replacement is up to you. Replacement with same, smaller or bigger implant, it's up to you depending on your goals. And we can discuss all of that on a one-on-one on your consult depending on your goals on long term. Breast lift, if you're removing, not replacing implant, most of the time you're gonna need a lift. If you're replacing with a smaller implant, most of the time you're gonna need a lift, okay? Sometimes if you're using the same size or a little bit bigger, sometimes we need to do a lift too. Why? Because that implant you got probably 10, 15 years ago. So your breast tissue changes, aging happens, gravity takes a toll. So your breast tissue is going to be changed, okay? Your breast might be saggy, and that is the most common repeat surgery that I see after implants. It's not a problem with the implant itself. The most common second surgery after implants is because with time the breast sag, your breast change, your goals change. Your goals as a 20-year-old are not the same as a 40 or 50-year-old, okay? So most of the time we have different goals and we have to or you want to have surgery to reshape your breast, okay? So breast lift, sometimes it's done. Let's talk about capsulectomy. What is a capsulectomy? Okay, so whenever we put a foreign body in our body, our bodies develop a capsule around it. So basically, the immune system reacting to the foreign body. This is not from our body. Let's put a capsule around it to isolate that. So it's not a threat, basically. That happens with anything, with a knee replacement, with a screw if you had a fracture, any foreign body, and it happens with implants too. And it's actually, the capsule, it's actually used in our advantage most of the time when we're doing revision surgery. If we have a healthy capsule, soft, not causing pain, not causing problems with shape, we use that capsule to actually support the implant the next time. We can do revisions with the capsule, put sutures, tighten it, anything like that, okay? But sometimes the capsule becomes thick, inflamed, and it causes what's called capsular contracture, okay? Capsular contracture may happen with any implant, saline or silicone, and it may happen to anyone, okay? There are some studies suggesting that people with the risk of hypertrophic or keloid scars have a very small increased risk of developing capsular contracture, but anyone that has implants has the risk of capsular contracture. Capsular contracture risk fluctuates between 6 to 15%, okay? So it's more or less similar to the implant rupture, and it may happen anywhere from 1 year to 20 years, or more, it's not something that's going to happen right away and then you're cleared from it, unfortunately. But that is when that capsule becomes pathological or it's causing problems, that is an indication for capsulectomy. What is a capsulectomy? Is removing that scar tissue from the body, okay? It can be done en bloc. En bloc means that you are removing the implant, the capsule, everything together as a block. So that's why it's called en bloc. You can remove the capsule as a total capsulectomy that is similar to en bloc, but it doesn't have to be removed with the implant itself. So you may take the implant out and then remove the entire capsule. That's a total capsulectomy. Or you can have a partial capsulectomy. So you can remove the implant and part of the capsule. That's most of the time the anterior part of the capsule, remove it as well, okay? or don't remove the capsule. Those are all the possibilities when we're doing an implant rupture or revision surgery after an implant. What are the indications? When do we need to remove the capsule? We remove the capsule when the capsule is causing problems, okay? What are the problems that the capsule can cause? Capsular contracture. So if you have a grade 4, so there are 4 grading systems for a capsular contracture, depending on the severity of them. Grade 1 is a more mild version of capsular contracture. Usually it's a little bit tightening, but you don't see any anomalies when you're looking at your breast. Grade 2, a little bit tighter. You may see some deformation, but not mostly symmetrical breasts. Grade 3, you notice a difference. One is probably higher, harder than the other. And grade 4, it's very hard, deformed, and painful. Okay, so those are the different 4. When we're on a grade 4 capsular contracture, then most of the time we need to do a total capsulectomy. Remove the entire capsule because that capsule is full of calcium, is hard, and your symptoms are not gonna improve if we leave any capsule behind, okay? The other reason to do a total or en bloc capsulectomy is when we have cancer associated with the capsule, okay? There is a very rare form of lymphatic cancer called BIALCL, breast implant associated anaplastic large cell lymphoma. Very rare, has only been seen with textured implants. So these are smooth implants. You see the capsule is smooth. Before we used to use textured implants. That cancer is associated with that, but it's extremely rare. So it does not mean if you have a textured implant, you will have lymphoma. But if you do have a textured implant, you should have it exchanged to decrease your risk of developing that lymphoma. If you do have that diagnosis, that is an indication of a total en bloc capsulectomy because that capsule has a cancer, so we need to remove it. If the implant is ruptured, if the capsule is healthy, you don't need to remove the capsule. Like I said, most of the time, if the capsule is healthy, the actual capsule helps keep the new implant in place. And you can actually put some sutures, that's called capsulorrhaphy, just sutures to kind of bring the pocket in, medialize the implant, position the implant better. So the capsule, if it's healthy, you don't have to remove it, okay? If we're talking about breast implant illness, there's a lot in social media, a lot of discussion about en bloc capsulectomy in patients with breast implant illness. There is no evidence behind the en bloc capsulectomy, okay? There is no evidence as of yet. It may change in the future, but as of yet that there's a direct correlation between implant and breast implant illness, okay? But it is something to consider and discuss with your surgeon if you do have symptoms of breast implant illness, which may be a lot of different symptoms like muscle aches, chronic fatigue, weight loss, autoimmune conditions, joint pain, maybe a bunch of different symptoms. But if that is your case, that is a discussion to have with your surgeon if you are a candidate to do an en bloc or not. The reason, and you say like, then why don't do an en bloc on everyone? Let's do just an en bloc on everyone, take that scar tissue out. Well, especially if the implant is under the muscle. That implant is against your rib cage, right? We have the pectoralis muscle, we put the implant underneath, so that capsule forms behind the pectoralis muscle attached to your rib cage. Trying to do an en bloc capsulectomy sometimes gets very hard and dangerous if it's attached to your rib cage, okay? And it may lead to injury to your ribs and to your lung. So to say, let's go ahead and do en bloc capsulectomies on everyone can actually cause more harm. So when to do an en bloc capsulectomy? When it's actually indicated. When we're having problems with the capsule and when there's cancer there. If there's no problem, we can actually harm you trying to get that capsule out. So most of the time, if there's no problems with the capsule, and it's very attached, then I will do a partial capsulectomy. I will remove the part of the capsule that's out there and that it's accessible, but keeping you safe, trying to avoid injury to your lungs and to your rib cage, okay? So I hope that this helps out. This is a very cool trick that I like to do. You see? Now you know that it doesn't leak out. Now Willie wants this. Yeah. So I'll get some questions now, okay? Yeah, guys, have any questions?
Will leaf with no implant decrease breast size?
Will leave? Can you repeat the question?
Yeah. Will a leaf with no implant decrease the breast size?
Yes, definitely. Whenever we're doing a breast lift or a mastopexy, the implant, the breast tissue is gonna be constricted or comprised with the breast lift. Okay, so visually, even if I don't remove any breast tissue, by just tightening the skin and tightening the envelope, it will look smaller. So if you do want to either keep the same size or go bigger with a breast lift, I do advise to add implants.
There's any vitamin I should avoid before surgery?
Yes, there is. So depending on the surgery and what we're doing, you're gonna get a pre-op list of things that you should avoid. The reason for that is most of the multivitamins come with added supplements that may increase risk of bleeding, okay? So that is the main reason why you should avoid some vitamins and supplements, but all of that will give to you on your pre-op call over the phone.
If a saline implant is deflated, where that water goes?
So your body absorbs it, okay? So the implant, the implant ruptures, your body will absorb the water and then you'll pee it.
Okay. There's any chance to have an implant exchange with a tummy tuck?
Yes, definitely that is an option. That is what we call a mommy makeover. So a mommy makeover is a combination of a breast procedure and a tummy tuck. If you have implants, that breast procedure might be implant replacement with breast lift or exchange, removal with breast lift, or any type of breast combination.
For Hair by Jaylene, can you get stretch marks if you go with a bigger breast implant?
It is a possibility. It is not very common, but it could happen. Similar to when you breastfeed. Breastfeeding increases the amount the amount of volume of your breast, similar to a breast implant. Usually breast implants don't distend much as the breast engorgement following breastfeeding, but you can see stretch marks with breastfeeding. You could, I don't see it a lot, but it could potentially happen.
Okay. 4 years ago, I got a BBL. Can it be redone?
Yes, definitely you can get around 2, or more commonly, recently, especially this last year, we're seeing more and more of reductions of BBL, and that has to do a lot with trends of keeping more proportionate to your body, or more of a slope look, or more of a thinner waist, thinner upper hips. So definitely we can revise or redo your BBL, rather if it's around 2 to add more volume, or a reduction to actually reduce the volume that you had before.
After an implant exchange, can I switch from gel to saline?
Yes, definitely. Whenever you switch implants, you can switch from one to the other. Saline and silicone implants are equally safe. There's some people that think that breast implant illness is only associated with silicone implants, but remember, both silicone and saline have the shell of silicone, so both have silicone in them. And the difference between the silicone and saline mainly is when they rupture, saline you'll know right away, silicone you won't, and the second one is the feel. saline feels a little bit more unnatural because it's a water-filled balloon versus the gel, which feels more natural, softer, because the gel mimics gummy bear, which is similar to the breast tissue feel or texture.
Okay, I got a BBL on October 22nd with Dr. Earl. My diastasis is so much more noticeable now, but less after wearing my faja. Why? And could I still be swelling?
Okay, so it's very common to have it more noticeable afterwards, because remember, if you're looking at yourself on a side view, we have the muscle, we have the subcutaneous fat here, and the skin. Lipo empties all of this, so the space between your muscle and the skin now is thinner, okay? So this bulging or diastasis, you'll notice it more now because this thickness has been reduced after the liposuction. With the faja, you compress that, so you may feel better. Also, 100% there's possibly still swelling there. So October is 3 months ago, so you still may have swelling up to a year after surgery, and especially in between 3 months to 9 months, it fluctuates a lot. So it's going to be very dependent to your garment, it's going to be dependent to your diet and to your exercise and lifestyle routines.
Okay, this is on YouTube. Just 1 second, please.
Hi, YouTube.
I have a very apple shape and have lost 100 pounds. Woo! I'm scheduled for a mommy makeover and a BBL, which should go first for less loose skin.
Okay, so congrats on your weight loss. That's amazing. Congratulations on that. I always recommend to do the mommy makeover first, okay? The reason for that is whenever we're doing liposuction on loose skin, there is an increased risk of having irregularities. Why? Liposuction is a procedure that we do from a small incision, putting a cannula and going in and out, right? So if the tissue where we're doing the liposuction on is loose, whenever I put my cannula in and out, everything is going to move up and down with me. I can try to stabilize it with my other hand, but it's still going to be moving. So the risk of having irregularities after that, it's higher. If we tighten everything, remove the excess skin, then on the second surgery, when doing the liposuction, everything is tight, so the liposuction is more even, okay? And that you have a better result, okay? Why? There's some people that think that if I do the liposuction, then I'm gonna have loose skin again. I've actually never seen that. The skin has already been tightened up, so we decrease this space, but we don't have loose skin hanging. Everything is tight, so everything will retract back down. So it's definitely better to do the mommy makeover first and then do the BBL 3 to 4 months after the mommy makeover.
We're talking about breast, so I should massage after?
Massages after breast, I don't recommend them, okay? There are a lot of people that like to ask their patients to massage the breast, especially after breast augmentation. I will let you know if you need to massage your breast, but regular rule of thumb, don't massage your breast, okay? The reason to massage your breast is, one, to reposition the breast implant. Sometimes the implants are too high. That happens to everyone, okay? After a breast implant surgery, the implants are going to look high and then they will drop, okay? That is the normal recovery of a breast implant surgery, okay? Sometimes if the implants are too high, if your skin is too tight, I'm gonna recommend to start massaging 2 weeks after surgery, okay? The risk of massaging the implant is, one, if you're having a breast lift with the implant, you may open the incisions up, okay? Because you're applying pressure, massaging that implant and putting tension on the incisions, okay? So I don't like to massage them, especially if we're having a breast lift with the implant. The other risk is that when you massage it, then you're increasing the space where the implant is developing. So the capsule may get too big and too loose. What happens when you see a capsule that's too big? When you lay down, implants may go to the sides because the capsule space is too big, and when you move, the implant moves instead of staying in one space, okay? So that's why I don't like to massage regularly, but some patients I do, but I'll let you know.
Okay, and the last one, okay? How often I should be checked after a procedure of
After any procedure?
yeah.
So our normal or regular follow-up for every patient is I'm gonna see you on a virtual follow-up post-op day 1, okay? If you have massages with us here at Pure, then that post-op day 1 visit will be here, so we'll see you in person. That post-op day 1 call or visit here is mainly to check the incisions and make sure that you are okay with all the post-op instructions, that you're staying hydrated, that you're walking, and that you're tolerating foods, no nausea, vomiting, etc. Post-op day 5, I'm gonna see you here in the office, and that will go over again all the incisions, all the check the skin, check for infection, check for wound openings. We'll go, most of the time we remove drains too, if you do have drains, and then we go over the instructions again. 6-week follow-up, then it's usually virtual, okay? If you are a local patient, of course you can come in person, and that's usually our regular post-op follow-up. But if you have drains, most of the time we see you more often. If you have obviously any wound healing problems, we'll talk more often. So it changes for every single patient, but at least post-op day 1, 5, and 6 weeks, okay? So awesome, you guys. Thank you so much. I hope you guys enjoyed this topic. And remember that today was my last day of promotions, but we are extending it until Friday, okay? So if you're still thinking about it, we do have a couple more days to decide, but don't overthink it because it's until Friday, okay? And important is that it's booking on Friday, okay? So it's not only quotes, but actual booking, okay? 20% down for deposit. Give us a call. How to do it, go to our website, virtual consultation link, click there, fill in the virtual consultation form, send the pictures, and we'll give you a call, okay? Awesome, you guys. Thank you so much for the questions. I'll see you guys next week on Tuesday Tips. Take care.